Good afternoon, everyone. Thank you for being here for another community update on the novel coronavirus and the disease it causes, COVID-19. First, there are no known community-acquired cases of COVID-19 confirmed in Lincoln or Lancaster County at this time. The state's first case was confirmed Friday, and over the weekend we learned more details about that case. The Omaha woman, who has underlying health conditions, continues to be treated at UNMC. Since then, 2 of her family members have tested positive for COVID-19. As you are aware, the Omaha woman was involved in a basketball game on February 29th in Fremont. One Lincoln team did participate in that tournament. Interim Lincoln Lancaster County Health Department Director Pat Lopez will now share with us how her team is handling the local individuals who are potentially exposed to coronavirus at that Fremont event. Our health department is the lead agency for our community's preparedness and response.
Good afternoon. We just wanted to let you know that we've been able, we actually had one basketball team from Nebraska that attended the event at the Fremont YWCA from Lincoln. And we've been able to reach out and contact all those individuals. Currently, we're monitoring them in quarantine, and monitoring means that we're daily checking in with them twice a day on their temperature in the morning and the evening and seeing how they're doing. This will continue until March 14th, which is the 14-day time frame from the onset of their exposure. And again, as the mayor said, we have no active cases in Lincoln at this time. We have 40 individuals that are in quarantine right now that we're working with on a daily basis, twice a day. So the things that we're telling people, our hotline has been very busy with calls. We're reminding people about the symptoms, the fever, cough, any kind of respiratory illness, and asking they either call the health department or their health care provider to get direction on what they should do. We continue to work with the state, our partner health departments, Three Rivers and Fremont, Sarpy, Cass, and Cass County and Bellevue and that area, and most importantly, Douglas County. We're all working together. We have calls in the morning and the afternoon each day, and as something comes up so that we can be very responsive to the community. We continue to monitor the situation, as I said, 24 hours a day, 7 days a week, and we have measures in place to detect any cases quickly, to minimize transmission of the disease, and to guide our community's response. And I just want to remind you, last week, our training center hosted nearly 150 healthcare professionals representing 60 healthcare facilities, including hospitals, long-term care, EMS, first responders, home health, and outpatient surgery centers. They all attended with short notice and participated in an exercise to share information to improve their preparedness across the healthcare system. Also last week, the health department convened 30 school administrators representing Lincoln Public Schools and 10 other public and private Lancaster County schools. This group was also very engaged in reviewing existing plans and preparing for the possibility of a local community outbreak. This week we'll be meeting with our early childhood care professionals from our facilities here in Lincoln to help them know more about the virus and what they need to do and assist them with any potential concerns they may have in their preparedness planning. The health department will continue to reach out to the community and provide guidance in what can be done to prepare.
Thank you, Director Lopez. As she mentioned, we continue to work in close collaboration with our community partners. Many of them are here today, and I want to thank all of them for their collaboration and focus on this issue. It's very important that all of us help to minimize the impact of COVID-19 in our community. We need people to take the recommended precautions seriously, and here are 3 reasons why. First, There is no vaccine for this novel coronavirus at this time, and there is no antiviral treatment at this time either. Secondly, by taking steps now to delay the spread of the virus, we can help prevent a sudden spike in cases. And that's really critical to reducing the burden on our healthcare system and other infrastructure. Our efforts to try and push out the spread of the virus as far into the future as possible is also key to give ourselves maximum time for preparedness. Third, we need to take personal responsibility for protecting ourselves and others. The high-risk group includes older adults and those with underlying health problems such as heart or lung disease, diabetes, or a compromised immune system. Many of us are not in that high-risk group. However, if we contract the virus or become people who can transmit it, we could expose someone who is at risk of serious illness. And that's why prevention measures remain critical for all of us. Again, here are some common sense practices that make a difference and will help prevent the spread of the coronavirus. If you are sick, stay home and limit contact with others as much as possible. Employers, please encourage sick employees to stay at home. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, you can use an alcohol-based rub with at least 60% alcohol. Cover your nose and mouth when you cough or sneeze and avoid touching your eyes, nose, and mouth. And finally, stay informed with reliable sources of information. You'll find accurate and up-to-date information at health.lincoln.ne.gov and at our hotline number, which again is 402-441-8006. Before we take questions, I just want to acknowledge that our community partners will also be available for questions should you wish to speak with them. From the medical community, we have Lancaster County Medical Society represented by Dr. Michael Rapp, Russ Gronwald and Lisa Vale from Bryan Health, and Derek Vance and Tim Plant from CHI St. Elizabeth. We have LPS Superintendent Dr. Steve Joel, and from UNL, Josh Davis, Director for International Engagement, and I think he has a longer and fancier title that he'll be able to say if he's up here. And from the Chamber of Commerce, representing our business community, Todd Wilchin. Last Friday, we implemented the incident command system that we use for events and emergencies like the floods we experienced last spring. That system is also helping to guide our preparedness and response now. It's very flexible and allows for rapidly evolving situations like this one, helps guide our preparations. This is certainly a time of uncertainty for our community, state, and nation. And I again want to assure our residents that we are working together to do all we can to protect the health and safety of our residents. At this time, we'd be happy to take any questions you may have.
So you've got thousands of people scheduled to come into this weekend. I spoke to the NSA this morning. They said at this time they don't have any plans to do anything major. They did mention things about encouraging teams not to do handshakes and trying to make sure there's plenty of soap and hand sanitizer available. But I mean, from the point of view of having lots of people from outside come into the community during something like this, what kind of things are you guys talking about or thinking about doing or anything like that?
Well, I would just say we certainly are concerned about at what point we would need to take a next level step of preparedness, like canceling large public gatherings. Because we don't have any confirmed cases of COVID-19 in Lincoln and Lancaster County, we aren't at this point doing that. But some of these preparedness measures that we're asking, these precautions we're asking everyone to take can still help. People who are sick should not come to the state basketball tournaments. People who are at the state basketball tournaments should be washing their hands frequently, and there are signs posted in the Pinnacle Bank Arena reminding people to take those important health care steps. Do you want to say anything more about that, Pat?
And as always, I think we've continually said we're going to base our response on what's actually happening in our community. And as you know, this is a rapidly evolving situation. And that's why it's been so valuable that we have so many community partners that we're working with, and we can talk together and make the best decision to protect the people in our community. So everything the mayor said is really critical about what we can do. Stay home if we're sick, wash our hands well, cover our coughs, but also know that if the situation changes, we're going to be back here to let you know what needs to be done.
Are the 40 people who are quarantined and being monitored, are they in their own homes?
Yes, they're all in their own homes and they are not ill, just to let you know. And they're not all from the basketball tournament. They may be travelers from other parts, from other countries that we're watching.
And those 40 are being quarantined here in Lancaster County?
Yeah.
I know LPS is on spring break right now, but we've already heard mumblings from parents about being concerned about sending their kids to school. At what point would it be a consideration for schools to close?
Let Dr. Joel speak to that question.
Excuse me. So from an LPS perspective, we've been meeting regularly and we'll be sending out continual updates. Would ask parents, students, interested community, check our website, and we'll make announcements when that time comes. We've not made any decisions about any of that. We have a couple of groups that are out right now in various parts of the country on spring break trips. They'll be coming back, and we're staying in constant contact with them. So no decisions on school. I'm well aware that a couple of school districts have called off, but as Dr. Lopez said, we're just going to react and respond to the information we have available to us. Right now, I feel very much that that we're as on top of it as we can be, but we'll see what the next few days bring.
What would be the procedure if a student goes to the nurse's office and has some of those symptoms, like a fever or a cough, things like that?
Right. Well, we'll intercede and make sure that we follow the protocols that have been developed. The student will, parents will be contacted, and the student will go home. We'll be as quick as we can. We'll be messaging out to parents as well next week, because we're scheduled to go back to school on Monday. That they have to pay attention to the symptoms, and we want students to self-monitor and to stay home if in fact they have any of those symptoms. So we're going to become quite a bit more aggressive in our messaging as we get later on into the week.
Should families start preparing for alternative child care options?
Well, hard to make that recommendation, but I certainly think in light of what's happening around the state, it would be a good idea to be thinking about that. But again, our intent is to have school, and we're going into it with the idea that we're going to be able to do that.
Have school nurses undergone any special sort of training to prepare to look out for symptoms in students?
They have. Our director of nursing has been conducting those. So I feel like we're having spring break has given us an opportunity to step back and do some constructive planning. But so much of what you've heard about this particular affliction is unknown. We don't know, but I think we'll have some good plans in place by the end of the week.
And just to add to what Dr. Joel said, actually, our health department has an extremely close working relationship with our school system, and they have direct access to our epidemiology and disease control staff, and we're able to respond to them quickly and provide guidance to them. And both school administrators from the system and their healthcare providers, their nurses and others in the school system were at the training last week. And LPS does an excellent job, as well as the other schools, in pushing out information.
Does Lincoln and Lancaster County have adequate testing supplies?
Right now we haven't had to turn anyone away. We have enough supplies. We're able to get people into the lab that need to have testing. But the other thing is, one of our private companies is now opened up and is providing testing. So the market for testing is going to greatly increase. LabCorp is one that announced in a press release yesterday, I believe, that they have a test available. And we anticipate another major company will announce on Thursday or Friday.
And this is just a date that was thrown out by someone who said they heard it out of school, is that they believe that the virus will spread to Lincoln by the end of March. Is there any kind of timeline or any kind of legitimacy to that? I'm just curious.
No.
Yeah, okay. So
That'd be nice if we
Right.
could see that coming, but no.
And do you think this spread is eventual? Do you think it's likely to happen?
Yes, yes, absolutely.
Why?
Well, you see what happened in Omaha and what's happening across the world. The spread happens, people maybe who aren't as symptomatic are out in the public or with somebody who's more vulnerable to the disease, and those people become ill and the spread continues. And that's why in the mayor's remarks saying, if you're home, stay home if you're ill, and wash your hands. But also remember, just because you're a younger person and not necessarily maybe at risk of having those serious side effects, you may be exposing your loved ones.
We've been told that people should expect significant disruption or inconveniences because of this. Would you say the same message?
You know, that's pretty hard to say without knowing exactly how the disease will unfold. But again, I think that goes back to the mayor's comment that as much as we can do to prepare and keep ourselves healthy and stay home when we're ill, we're going to help moderate that spread.
The health and safety of our residents is our top priority, and this is a situation where we truly are all in this together, and there likely will be inconveniences in the future, but every single person who's working on a response and doing our preparedness efforts is weighing how we minimize those secondary and third order consequences that may arise. For instance, were there to be a school closure, people who are medical providers also have children, and we are trying to make sure that we maximize the number of medical providers who are available to tend to our sick residents. So we are thinking through all the ways that this could have rippling effects and trying to do our very best to minimize those rippling effects. But it's good for people to know, to think through, how might I be impacted? What can I do to get prepared for future inconveniences, recognizing that we're all in this together and we all have a part to play in the solution, which at this point really is about slowing the spread so that we don't have a significant spike on our healthcare system, so that we can maximize our time for preparedness.
Should we be telling viewers or listeners that now is the time to go ahead and go and get your 2 weeks of food in case this thing does come to Lincoln and start majorly inconveniencing people? Is now the time to go to the store and do that and stock up?
I guess what I would reiterate is that for any emergency preparedness efforts, whether it's severe weather or the normal flu, that is always a good practice to have a set of emergency supplies at home, which can include 2 weeks worth of food. And so that's just a good standard practice for emergency preparedness. If there, more as we want people to take this seriously and recognize that if they are exposed and if they find themselves in a situation where they need to self-quarantine at home for 14 days, it'd be awfully handy to have all that taken care of. So it is a wise practice. All right. Thank you, everyone, for being here today.